Hi, I'm Dr. Bo Anderson, a licensed acupuncturist and board-certified herbalist. I'm currently the academic dean at Pacific College of Oriental Medicine here in New York City. The book I'm going to review today is Integrated Pharmacology by Greg Sperber and Bob Flores. First, I'm going to talk about the general structure of the book. The first 3 chapters are introductory in nature, and they're the ones that I would recommend that everybody reads, because they tell you what's in the book and what's not in the book, and also they tell you about how to look at the evidence they present in the book with regard to telling us whether there has been any prior incidences of interactions between certain drugs and certain herbs. And that's an important aspect because there is a lack of real clinically relevant evidence that's specific to individual pharmaceutical drugs and herbs. Mainly what we have is lower quality evidence, and a practitioner has to make an assessment as to how much they're going to factor that in when they're deciding whether to give a certain patient Chinese herbs that are taking pharmaceutical medications. The second chapter deals with pharmacokinetics and pharmacodynamics. That's important because you need to understand the concepts of what happens when a patient takes a pharmaceutical drug. And because we lack real chemical information about what happens between drugs and and Chinese herbs within the body, we have to use conceptual approaches to thinking about whether there could potentially be a negative interaction. So students learn about the actions of drugs and how they're metabolized in the body, and practitioners can refresh their memory of that to make an assessment of whether there would be a potential negative interaction. The book also gives quite a lot of detail about exactly how to go about assessing a patient who's taking pharmaceutical drugs, and an approach to deciding which herbs to give them and how much, how to deal with potential adverse effects, how to interact with their Western doctors to monitor these patients. Each chapter that follows the introductory chapters deals with the individual drugs, and they're categorized according to their physiological function. It's very comprehensive in nature. Towards the end, in chapter 13, there's a very interesting section on how drugs would be looked at from the perspective of Chinese medical characteristics. So each class of drugs is described, for example, whether they're acrid or cold, or whether they would engender wind or be likely to be downward draining, like a diuretic, for example. So that enables the practitioner to know whether they're duplicating the action of both the pharmaceutical drug and the herb, and also to assess side effects and know whether they are likely to be caused by the drug. The book is unique. There's really no other book on the market like this. It's very user-friendly, and I really think that it's a book that every practitioner should have on their shelf so that they can consult and educate themselves about the mechanism of action and likely interactions between Chinese herbs and pharmaceutical drugs. On behalf of Kamwo's online product review team, I'm Bo Anderson. I hope you've enjoyed this review, and please watch out for the upcoming reviews about other books that you will find on the website.